Greetings and welcome to Mental Health Trailblazers, Psychiatric Nurses Speak Up. I'm your host, Indrias Kassaye. We are continuing our conversations around the mental health challenges facing adolescents and youth in America today with a spotlight on young immigrants. 2020 U.S. Census data confirmed that while America's population is rapidly aging, the number of underage 18 youth declined during the decade 2010 to 2020. This decline would have been even sharper had it not been for rising numbers of young immigrants, hence our focus today. There will soon be more people retiring and exiting the workforce than are being replaced. Immigrant youth are the fastest growing population within public schools in the United States, first and second generation immigrant youth making up roughly 1/4 of the school-age population. Given these demographic trends, moving forward, immigrant youth, the majority of whom are from ethnic or racial minority groups, will have a substantial and expanding role to play in all aspects of life in America. Joining me today for this discussion about how this critical subgroup of young people in America are faring is SAMHSA Minority Fellowship Program at the American Nurses Association alumna, Faven Mesfin. Faven, welcome to Mental Health Trailblazers.
Yeah, thank you for having me. It's a pleasure.
It is our pleasure for you to be joining us. And let me start by asking you to please introduce yourself to our audience.
Sure, yeah. So I recently graduated from UCSF with a master's in nursing to become a psychiatric mental health nurse practitioner. Mm-hmm. I'm also the eldest daughter of 4 daughters to Ethiopian and Eritrean immigrants, my parents.
Okay.
And this topic is very near and dear to my heart because I was the first generation American in my family. So,
okay.
Yeah.
And tell me, why did you choose to be a nurse and a psychiatric mental health nurse in particular?
I've always been really interested in mental health and kind of why people do the things they do, how traumatic events affect people, really just kind of the psyche in general. Mm-hmm. And my family has a healthcare background, so I was exposed to nursing and all the different healthcare opportunities at a young age, luckily. But it wasn't until after college that I decided to pursue nursing. I knew that I wanted to be able to have a bunch of tools to help people that are facing mental health challenges. And there are many ways to do that. But I felt that nursing was really holistic in the way that it approaches people. And I think in mental health, my talents were best served in a holistic way because I think there's a lot of socio-emotional components that affect mental health. Mm-hmm. And just caring for and seeing the whole person. And that is what I think I've been able to do even in my daily life. And I felt that nursing would allow me to highlight my own skills in that way the most. So I decided to pursue nursing. I always knew I wanted to be a nurse practitioner and work in mental health. So I pursued an accelerated program at UCSF, started in 2019, became a nurse. And then while I was doing that, I was working with vulnerable communities in the San Francisco Bay Area, doing COVID testing for free. And then I was also going to school full-time. I graduated and I'm working right now at Los Gatos Therapy Center, which is based in South Bay, so near San Jose for people who aren't familiar with the area.
You are, I think, an ideal person to be discussing this as somebody who is from an immigrant background yourself. Were there things in your childhood or growing up that made you think, perhaps focusing on immigrant populations would be an important thing to do?
Yeah, it's interesting because I think, when you grow up with a certain identity, you don't think about it as being, you just think about it as an extension of yourself because it is. So I don't know that I realized it so early on. I think I put it together later as I have grown up and seen the impact of my own culture and the cultural ideals and how that's impacted me. So I wrote about it when I was applying to grad school. That was one of my supplemental essays. Mm-hmm. But it's just, I think that culture and background inform the stories that our parents have and which result in shaping you and kind of the values. The biggest things I think that I was made aware of also is that there's an identity issue almost because I was born in DC, grew up in Silver Spring, Maryland, and I'm for all intents and purposes American, quote unquote, but my first language was Amharic. I didn't speak English until I was 5, and my name is not a common name people hear, so on the other side, people are, think that I'm not American or I'm from somewhere, when in reality, I'm technically not. And when you go into my house, there are certain sets of expectations and values that I don't think non-immigrant households necessarily implement or carry. And some of those things, I think there's a really high expectation for achievement that likely comes from having people make sacrifices on your behalf. So my parents to come and leave everything they know. Also, they didn't really have a choice. They don't come because they want to. They come for a better life. I think if they had it their way, they would have stayed.
Sure. Yeah, no, it's not easy to make that decision to pick up and leave your home, especially when you come from a culture and a background like ours, which is steeped in so much history and tradition. And it is a huge leap in many, many ways when you uproot and come to this land of, what we always hope is a land of opportunity. So what would you say are the major mental health challenges that immigrant youth and adolescents in America face today? And, if you could share examples from your own life or from, your experience working, that would be fantastic, just to illustrate what's going on.
Yeah, I think there's a couple things. There's statistics in terms of diagnoses that people face. They just have higher rates of depression, anxiety, and post-traumatic stress disorder. And the last one, typically when people have immigrated themselves. And I think it's double the rate of their peers per the American Pediatric Association was the most recent number I've seen on that. Yeah. But I think the identity challenges, kind of like the ones that I described for myself, sometimes acculturation stress and having different expectations at home and then different expectations socially, and kind of trying to reconcile that can be very challenging because it's something that becomes apparent early on, and that lack of identity or maybe bicultural identity or straddling the two can result in kind of mental health impacts, just because people feel a little more isolated, or they feel like it's harder for people or for them to fully relate to someone. And that goes from both the cultures they come from, because for the family that's maybe immigrated, they're not blank enough, but then for Americans, they're also not American enough, despite potentially being born here, coming at a young age. In terms of what I've seen and how it impacts mental health, I've seen, or I've had examples of people that they don't get treatment until they're older. And then in terms of also just kind of funny stories about the identity thing, my aunt, she tells her kids, they'll tell her, Mom, this is outdated. This is not, we're not doing this. We're in America now. And she's like, that's fine. When you're outside the house, you're in America. And the second you come inside my house, you're in Ethiopia. So you have to listen to my rules.
What happens to these young people as they are navigating this new world and old world, straddling between, cultures and identities? What happens to them that then causes alarm or causes a need for intervention?
Yeah. So you're saying what does it look like when they're not doing well?
Exactly.
I think this definitely varies for people, and it depends on age and if their parents are immigrants or if they are, first gen. So I actually have an example about that. I think a lot of times in this population that I've seen in my work. So first, usually the people that are immigrating, if they're adults, they have more resilience than people who have not. Thinking about first generation Americans, or their parents have kind of witnessed a lot and gone through a lot. And because of their resilience from that, they're able to kind of maybe better cope, whereas the children are not. And oftentimes there's a stigma that is kind of held culturally, and this goes across cultures. I've seen it, I think, from pretty much almost all non-Western societies, where mental health is thought of as psychotic episodes or psychosis, and anything outside of that is just not legitimate. And obviously these are generalizations, but this is a trend that I've seen. And so what ends up happening is the kid has to decompensate pretty badly before their parents realize that it's an issue. And the reason that matters is because obviously, especially if you're under 18, your parents are likely the vehicle to getting care. Mm-hmm. And as an example, I had this one patient. She's Mexican-American. She came to America when she was 3 years old. She was really depressed in high school. I don't think her parents recognized the symptoms and kind of thought it was different things and attributed it to more personality, maybe errors, as they would say it. And then she had a suicide attempt. And then that, scared her parents. And then they started to like kind of see that this is a bigger issue. And there's countless stories like that. This is just one example across cultures, like you said. And I think that that's, that shouldn't be the case. And I think that, again, like when you think about resiliency, one of the bigger things that people talk about is social support. And in different countries, you have more of that, literally. And then sometimes by the government, but a lot of times not enough, which is why people move, but try to immigrate.
Yeah.
So I think that, that's a really big thing. A lot of cultures are very collectivist and have that community. I also think that depends on where you move in the US and what that looks like. For example, for myself, my parents ended up moving to one of the biggest hubs for Ethiopian Eritrean people outside of the country. And a lot of their friends ended up moving to that area. And then there was a really big community network and support. So that support also helps my parents for taking the stress off having 4 kids, but also helps for me with identity and realizing like, oh, there's a bunch of people who are like me around me that understand the same kind of struggle. Whereas if you go to somewhere like you move to, there was a patient of mine, she's from Ecuador, and her family moved when she was 11 from Ecuador to the United States. And she ended up moving to Wisconsin first. Mm-hmm. And that was very challenging for the mom. She felt like she had no support and was, kind of shunned in the community because of the lack of diversity. And then that in turn, more stressed out, it's more difficult to parent, especially this patient had a single mom. And that impacts the kids' mental health, because if your parents are stressed out or having, reacting a certain way and they treat you like that, that's impacting your early childhood experiences. So I think that's where the kind of rates of, increased anxiety partially can contribute to. That's unique from other people's challenges. And also just trying to navigate, okay, how do I act at school? And then how do I act at home? And how do I navigate all of this? I think a lot of mental health comes down to people feeling heard and understood. And there's also the fact that when people are adolescents, there's like, at least what we learned here, very different than my parents taught me, is that there's like a lot of experimentation and a lot of like kind of pushback. And I think that depending on where you are geographically, that can kind of get influenced into the quote unquote wrong crowd and whatnot for anyone. And I think there's what I've seen also in a lot of these cultures is that it's very strict. A lot of them are very conservative cultures where, they have the same expectations for their children that their parents had for them. And I think when that tries to get so rigidly enforced in a different context and without bending, people start, like lying more and they start being dishonest. And there was a talk that a really fantastic resource, if anyone has not heard of her name is Sahej Kohli. She is a therapist. She went to GW. She has an Instagram called Brown Girl Therapy, where she talks a lot about immigrant children mental health, and that's across cultures. But at one of her talks, she talked about how that population, lying is a form of kind of like boundary setting, because a lot of times parents won't accept the truth, or they won't allow if someone to do, there's that joke that a lot of different people have said about like, if you have fun one day, your parents won't let you have fun the next day. So I think
when you say you lying, they're not telling the truth to their parents, you mean?
Yes. And that's even like the example she had used was this 30-year-old woman didn't want to come home for the weekend, but her parents would feel really bad and have a lot of consequences if she said, I'm tired, because the whole, in their culture, I think she was South Asian, that's not acceptable because you're the kid and you should be coming to the parents whenever you have time. Like that's the kind of the cultural ideal. But to relate it back to your question, I think in high school, I see a lot of kids lie to their parents. I mean, regardless, immigrant or not, but I think some of that, the reason is to try to kind of straddle both the cultures and identities. And I think it would be great if, asking to change culture is a really big ask, or asking to change that. But I think some kind of understanding of trying to have a safe space for children and teens and adolescents and even transitional age youth. And if that's not, your parents, and that can be people in the behavioral health workplace, I think that just kind of making people more aware of these unique challenges that people have will hopefully prompt behavioral health workers to try to better understand that, so they can be in a place to be a safe space to a person. So I think just learning more about the culture and also the impact of family on the person, because I think a lot of Western cultures are a lot more individualistic, and So I used to get that all the time as a kid growing up. Well, why does it matter? Like, just do what you want, or you're 18. And I'm like, I'm always my parents' kid, if you ask them. And even for some patients that I have that are 19, 20, I had a patient once that she came for anxiety and stuff, and she wouldn't take a medication unless her parents knew about it. And I've heard some people talk about, oh, this is like enmeshment, this is not healthy. I disagree with that completely. I think that, she believes that her parents, and was raised in a way that her parents are, people that are looking out for her best interest, and she has a good relationship with them, and she wants to consult them. So if her parents tell her, why are you taking propranolol? It's a blood pressure medication, which is what they said, which is used off label for anxiety. Then it makes sense to talk with her about those reservations and hear her out in a non-judgmental way, and then see what would make more sense for her or what her goals are and how I can help in that case with that. So I think just, we do things in a certain way, especially with medication, that is not necessarily done in other countries. And I think understanding where someone's coming from.
In your practice and then in general, how do immigrant youth connect with the behavioral health workforce? How are they referred to you? How are they identified as needing? Is it something that they have to come forward with, or are there mechanisms in place that, for example, in schools, because that's probably where they most interact with the services and, the American system, if you will, outside of their home. Mm-hmm. How do you find them, those who need support?
Yeah, so I can tell you a little bit about our clinic and then just in general what I do know. So I'm primarily see transitional age youth. When it's children that are younger than that, usually they're having a problem in school, teacher recommends they seek out treatment, or the parent sees that they're struggling and then goes through their insurance and then finds them. In terms of the demographics in the South Bay, so the area where my job is based, mm-hmm. I'd say there's a good amount of East and South Asian immigrants and then a Latino population as well. So that's just the kind of makeup of that area. So I think in turn that ends up being, a good amount of patients that I see. Mm-hmm. And then the adults seek it out on themselves and they go through their insurance and then do it. So a lot of people that, they're adults, but they're still transitional age youth I had actually the Habesha patient. She said that she had been diagnosed with ADHD when she was maybe 10. And then her parents said they're not treating her for it because they don't really think she has it, which led to, struggling in school until and through college, through her master's. I mean, she did it, which is great. And then she came and she was like, yeah, I think it's time for medication. This is impacting my work. So I think there's a lot of stuff like that I hear where it's like, when I was a kid, my parents didn't treat me. I think schools are a really big place where these things get discovered. And I would urge people, if they have this population, try to get the parents engaged as much as possible. And I think that comes with not trying to tell people about themselves, but also trying to highlight common goals. People get really sensitive to your kid is having problems in school.
Right. So how do you navigate that? If you have, as you mentioned, there's a lot of stigma around mental health. Mm-hmm. To tell somebody that their child has a mental health issue, I know from our own Habesha Ethiopian culture, it's seen as a big a negative mark on not just your child, but your family, almost like it's a curse. So how do you then work with that kind of stigma to ensure that those children do get the support that they need?
Yeah. Well, the first thing when it came to my head, and this is a bigger solution, is I think having representation in this field is a great thing, which is why Minority Fellowship Scholarship is amazing. Mm-hmm. If someone is coming from the same background, it's easier for people to feel comfortable to talk about it. Reminding people that it's, I think it's the language that people use. This is not your kid's nothing's wrong with your kid, that this is just something that could help them. We have these resources to do so. The medication conversation gets difficult, but I think it's a lot of motivational interviewing. So for nurses, you know what that is, but it's asking people, where are you? How do you feel about this? What do you want to change? And it's kind of over time, kind of trying to get, almost like doing a little bit of therapy to try to get people to see the gap between what they want for their child and how their child is acting, behaving, taking in information, and what resources you have that you can help with that. And also reminding people, nobody's going to know. I think there's this this like concept that I remember being aware of when I was younger, where people are like, oh, like this is a stain to your record. Like, that's not true. But what is a stain to your record is your grades.
Right.
And I think just communicating all these things in a way that people can understand and not feel threatened. And I think in making people not feel threatened, that require active listening and engagement and building rapport with these families, and not kind of coming in with like this is, we have this book, the DSM, that says this about your kid and you need to do this or else, that's not going to help anyone. It would be helpful for just all the communities to kind of work on destigmatizing mental health. That is one of the biggest barriers for adolescents and this population to getting care, and communicating again the challenges that people have faced, even though they have been probably far worse. Like a lot of these people's families have left war, famine, all these things worse. Right. But I mean, I think it's not comparative, because it doesn't really matter in the sense of if your kid is impacted and struggling, then it doesn't really matter what is doing that. It just matters about how you kind of reconcile it.
You hit on a very, I think, important point when you talk about language, like the words that we use, the way that we describe and explain these things can be a barrier in themselves. And I'm wondering if we need like a new lexicon to identify and determine and state, this is the challenge, to put it in a way that will not trigger the stigmatized thinking that people might have about mental health. You mentioned barriers to accessing care. Stigma and the way that families and communities think about mental health issues are one definite barrier. What are some of the others? I think you mentioned insurance. If a family does identify that they have a child that needs support, how do they pay for it?
So it depends on if they have insurance or not. There are, even if they don't have insurance, there are like kind of like free clinics. But I think sometimes the problem also becomes people just get very overwhelmed about what's maybe happening or the behaviors their child's displaying. And I think it's hard to navigate that. But I mean, really just like searching even free mental health clinics near me or something like that. If it's coming from a school, the schools typically tell them kind of, maybe not always, but what they think that's going on and what could be helpful. Because it doesn't necessarily always mean medication. It could mean therapy. Therapy sometimes can be very expensive and out of pocket. And the challenges also become, there's long wait lists for the places that are free or reduced cost. And sometimes that's an additional challenge that might not be feasible for people if they're working a lot. They don't have the time to take their kid.
Right.
Luckily, after the pandemic, Zoom has become so much more accessible for people. So a lot of that can be conducted on Zoom as well. Also, to your point about the language, I was just going to add in something I usually say to people, especially that come from these backgrounds that have never been diagnosed with anything. And I really do believe this as well. Like the DSM is a helpful tool, so the Diagnostic Statistical Manual of Mental Health Disorders, for people to kind of identify a cluster of symptoms that could be, only because we want to know how to treat them, right? So I tell people all the time, yes, you meet criteria for major depressive disorder, but there's a lot, like that's only one thing. It doesn't mean that you are depressed forever. And this is not like a end all be all thing. Some people do have that diagnosis for most of their lives, but a lot of people also don't. They can go into remission. And I tell people that while it can be a chronic illness, I think the most important thing to focus on is like, okay, I'm exhibiting these symptoms, and because of that, these are the things that can be offered to me to help me, whether that's therapy, whether that's medication. Especially with medication, I see a lot of apprehension from people with these backgrounds, because that's usually not how their parents have done it or their culture does it. People prefer quote unquote more natural things. And I also think there's a place for that, and that should be included. I have some patients where I think medication could really change their life and they don't feel comfortable, and also accepting that that's where they are and doing motivational interviewing and trying to see what their goals are and telling them my goal usually aligns with their goal, which is to feel better, and then kind of working our way backwards. So I think even in explaining disorders kind of helps people understand stuff. Because, for example, people will meet criteria for major depressive disorder probably in a severe way after they've like lost a loved one, right? And that makes sense. And I think it's just, these are just words that can kind of be sometimes honestly arbitrary for people and don't capture the whole picture. And it can be helpful to know where they're at right now to kind of move forward. And that usually helps people. I see that people feel more comfortable when they think like that. There's also this thing of mental health as an American thing. Like, it's something that you have like a luxury to kind of do. And to some extent, I can see where they're coming from, where I think about people who have 3 jobs and kids and don't have time to rest. But the thing is that if you don't tend to it, there's physiological changes that happen from sustained stress that will kill you, really. And I think that that's, I don't say it like that to people, but yeah.
And I think calling it mental health and doing it in an organized sort of systemic way with services and, people having clinics and places where they can go for this specific targeted service, that might be something that's unique to well-resourced countries like the United States. But I think the life that a lot of these immigrants have left in their countries, and I'm thinking to our country again in Ethiopia, there are things that we have in our society, in our community life, that we don't call it mental health or therapy, but they pretty much perform that function. I'm thinking, for example, the coffee ceremonies that we have, the people coming together, discussing, talking, having a shoulder to either cry on or discuss with. But you mentioned your training at UCSF, and that's one of the leading schools in terms of nursing. When you think back, how well do you think you were prepared to deal with the kinds of things that you are now experiencing in practice when it comes to the mental health of young immigrants?
Yeah, that's a good question. I think school can prepare you as much as they can, and then you work, and it's a different lesson and different things you have to think about. For example, nothing prepares you for when you have to call CPS on a parent, right? Like, I don't want to do that, but sometimes you have to, right? And I had a very kind of heart-wrenching case where I had to do that for an immigrant mom, and luckily nothing happened, but it was just challenging because I could see how background and ways of disciplining that were acceptable in where she was from and in America differ, and I have these laws and I have to call, and I don't think that child would have been better off anywhere else, and I have to call. So I think nothing really prepares you for stuff like that.
I think that is very interesting, and especially when we think about the demographic changes that I referred to earlier on when we started this conversation. More and more American young people are from immigrant backgrounds, and so if the nursing workforce, if the behavioral health workforce is to effectively respond to their needs, and I think nursing education, behavioral health education needs to adapt accordingly. So hopefully we will see more of that. But are there any things that come to mind that you think might help in that process? If you were to go back and have an elective or mandated class, like, what would that look like?
Yeah, no, I think that's great. I mean, I think probably because of the people that they admitted and the interest in social issues that UCSF has had a history of being involved in, it was kind of conversations about identity, race, background, and all those things were kind of infused in a lot of different things, which was, I think, a really great way to do it. And I think with this specific population, kind of breaking down the nitty-gritty of what that looks like, because I think depending on where you're from or what you've grown up around, I think people think immigrant means blank, like a very specific, narrow thing. And I think it would be fantastic if there was classes about that across the board. And I think you're right. It's in everyone's best interest to learn about this population. I think if you're working in mental health, much of the country is going to be another immigrant or immigrant children and immigrants. And, financially, you can say if you want people to be as productive as possible, then they should invest in that, right? But I mean, I think kind of morally, it's a lot of people around you. And I would hope that people would care to, especially if you're going into mental health, understand people as much as possible before treating them, because that will make the outcomes better.
There's one group of young people that I wanted to ask you about, those who are coming from conflict areas, those who are escaping for their lives, or those who are taking really dangerous journeys on their ways to America. What are the particular needs that you're seeing with that group of young people, and what should behavioral health professionals be looking out for when it comes to them?
I mean, I think the biggest thing in terms of clinically is trauma and PTSD and screening for that. And then also a lot of times if people are, and I think this happened when I know there was like drives in the DC area after the Taliban took over Afghanistan again, and when people were trying to leave, and people were like donating stuff to try to get people access to basic needs and resources. And that, I mean, that's really real. But that becomes the hard part, I think, about mental health and being a mental health provider, is that it doesn't exist in a vacuum. You're not really doing enough if you're only, in my opinion, if you're only treating people with medications, and which is the main thing that we do, because there's this whole other side that really impacts well-being. And I think that part of that is, if you can and when you can, like doing advocacy work and volunteer work that helps connect people to resources, like basic resources. Because if you don't have that, there's no way you can even think about wellness, right? Like, it's the Maslow hierarchy of needs.
People come to this country with great expectations. People come with expectations of a land of opportunity, the American dream. If I work really hard, then I can make it. And I'll be able to not only live a good life, but I'll also be able to support family, people back home. When they come here, they're faced with the reality of things, which include, for people from racial and ethnic minority groups, discrimination and xenophobia. Are there any specific interventions that either you do or that you would recommend when it comes to healthcare professionals working with these young people that can help them navigate the race dynamics in this country?
Yeah, I think I'm going to answer that two parts. So the first thing is, I think in order to kind of help with lowering rates of discrimination and xenophobia, I think that everyone needs to check their own kind of like bias, and there's, you know, an endless amount of tools that can do that, and then try to actively make sure that people are keeping that in check. So I would say for all healthcare professionals that they should think about that and think about what their preconceptions are for different groups to adequately treat them, because it does play a very big role. And then I think in terms of people like trying to navigate that, I think it goes back down to like therapy is a great option for people. And I know sometimes it's not always accessible, or even just having like support groups at a lower level of, you know, people that are in the same background or demographic as you and maybe have those kinds of challenges, and discussing that. So at least you have people to kind of feel in community with and kind of talk about that. Because making sense of identity is really complicated. And I think especially for the population I described, of the ones that are either came here when they were young or came to a Western country or were born in the Western country and their parents are from somewhere else like myself, it's kind of like a lifelong thing. And there's research to show that like if you can manage both, if you can feel like you're a part of both, that helps with your own mental health. How you do that, I mean, I think there's, you know, great tools like journaling, reading books that are also more accessible to people. And there's been more of a discussion about this, I think, in recent years. So there are some culturally specific books out there that talk about people's own experiences. And I think really identity is kind of what you make it. And I think there's this reconciling of, I mean, same aunt that told my cousins that they live in Ethiopia when they walk in the house. Like, I think some people just are really immersed in their identity and it doesn't even matter what people think they are, or those kinds of things. I see that a lot in people I know personally. But I think for the generation that's the first generation American, it is a lot more challenging. And also, and I think it happens over time, right? Like as people grow up, okay, what are my values, and kind of working the way backwards, and which ones are the ones that my parents told me to have, and which ones are the ones I actually believe. And I think that over time, especially with the transitional age youth, like the 18 to 25 group, you see a lot of that exploration. And I think that's a question I even ask patients that age in general. But I think especially from these backgrounds, I think it makes a big difference in trying to shape yourself. And it doesn't have to, and realizing like, it doesn't have to be fully one or the other. You don't have to be fully in an individualistic society because you live here, and you don't have to, you know, fully subscribe to all of the things that maybe have expectations.
Have you had patients come to you who've expressed that is a challenge for them, like that they've faced discrimination or xenophobia? Yeah,
definitely. I have one patient right now where she actually ended up switching providers because she wanted someone that could understand this. And I knew that before I spoke with her, so I told her about myself a little bit more. And I think that was very helpful for her and in the rapport building. I think people experience that, and it's really, traumatic for people, and it shapes the way they view themselves. There's a lot of research actually that talks about how first generation, this is actually specifically for people from like the African Caribbean diaspora. So if parents come here to America, their children's, so my generation, work or financial and healthcare outcomes are the same of white youth in their age group. Mm-hmm. And then, so the following generation, so for me, like my kids' generation type of thing, their health and financial outcomes are on par with Black Americans. And that's because of racism and all those things and how that impacts people. That was a pretty jarring statistic when I heard that. You come from a place where that's sometimes not as present, because that's not always the case with like tribalism in different countries. But when you come here and you have to experience all of that you didn't experience in terms of maybe like the color of your skin in your own country, it is really damaging.
But it's the reality of living in this hemisphere, is the way race has shaped the way communities engage with each other. What did your parents think when you told them that you were going to enter the psychiatric mental health field?
I've been saying that for a long time. So I don't know what their initial response was. Like I said that when I was a kid. My dad would, when I was a kid, even like read me like, those columns in the newspaper. Be like, what would you do? When I would like say my response, and he would check it with the lady who wrote it. I think my parents...
So they were supportive.
They were supportive of that. But I had some family members or people that they were like, why are you doing that? Like someone told me, when you do that, you might, have the problems yourself. And I'm like, that's not true, but okay.
Meaning people thought it might be contagious?
Yeah. Like,
and have
how
you...
it works.
and I'm going to be a little bit personal here, but have you ever felt that you needed some sort of mental health support yourself?
Yeah, I mean, I've definitely been engaged in therapy, and I think that's a great tool. I also think in my generation, generally, it's a lot more widely accepted. I tell people, including like members of my own family that are older than me and stuff, I tell them it's really just a tool for self-development and exploration. It's not always like, oh, I'm in this terrible crisis and I need a lot of help. Like I think people think you have to be really decompensating to go to therapy, but really it's just a professional that helps comb through thoughts and ideas. And actually, first therapist I ever had was, I want to say she was Somalian American, and I was specifically seeking out a similar identity to me at that time because I was trying to decide what I wanted to do and with my career, like the way I wanted to go in terms of, like I mentioned earlier, of there's many ways to work in mental health, and there's like pressure from culture or cultural group to be a doctor or whatever it may be. And I think that there was some pushback, and I had to really identify, like separate myself for the first time in my life of like, what are me, Faven Mesfin's ideals versus what is everybody else's. And because it was so intertwined my whole life.
And your therapist helped you in that.
Yeah.
And what did your parents think when you told them that you were seeing a therapist?
I think they like, didn't really get why you need to do that. Yeah. And I had to kind of explain it to them. And yeah, I don't know if I think they understand now.
Do you think it would have been different if it was called something else? Again, going back to that whole issue of language, if we said that you were seeing a coach or a counselor.
Definitely.
Not necessarily a counselor.
Yeah. Not counselor. But yeah. I think if it was like what do they call it? Like the people that work at schools, like the advisor, that would be different, right? Because really that's what she was really helping me with. Like it was just more so like seeing what other options there are and aligning my values to them, which is really also what an academic counselor, I think that's like the view of what they advisor. Do, right? Advisor, yeah. So, yeah.
So I wonder if one takeaway from our discussion might be that as we explore different ways of packaging this thing called mental health and providing these essential services for this community that are in flux and, by the nature of their movement will need some sort of support, if we call it something else, let's call it coaching, and make that available for all the young people who are coming in to this country, because I think it's very important to catch them really early before it ferments and becomes something
Yeah, I think so. I think that could be great. I mean, if it was packaged, I mean, ideally, like if there was like a resource or center, and there might be places like that and I'm not familiar with. But I think if that was kind of all connected to each other, where it's like, okay, you help get, your primary care, your insurance set up, and then you also talk about mental health. And yes, sometimes it's calling that. And then that comes again with like the clash of, okay, well, how do you explain to people this job that says psychiatry is really just coaching, or how do you make them feel like that? And I think that goes back to what I was saying too about explaining the differences between, okay, you meet criteria for this or whatever, or saying it in a way that like, these are the ways that we do things here. And I say that to people too all the time, like, and it doesn't really mean that something is wrong with you. It just means that like, we want to help with this thing.
Absolutely. It doesn't mean that you're crazy. And that, I mean, that's what people are thinking. People are thinking, you say I need mental health support. That means you're telling me that I'm crazy.
Yeah. And a lot of times it'll manifest in like physical health stuff. So you can even like say it like that, like to prevent, high blood pressure.
Absolutely.
But
yeah. And I think in immigrant communities, that is something that, you see a lot of, not just immigrant, even back in the home countries, you see a rise in all of these different chronic diseases and illnesses that we didn't have before. And I believe that a lot of it is related to the stress that communities have gone through over the past decades with all the wars and conflict and all of that have been shaping our societies and that have been pushing us to come to this part of the world. Well, it's been a pleasure speaking with you today, Faven. Thank you very much for giving us the gift of your time.
No problem.
And that does it for this episode of Mental Health Trailblazers, Psychiatric Nurses Speak Up. I hope you've enjoyed our discussion, and I look forward to you joining us on future episodes. This is the Minority Fellowship Program at the American Nurses Association podcast, featuring nurse scientists addressing the psychiatric and mental health issues affecting underrepresented communities across America. You can always find us online at emfp.org and wherever you get your favorite podcasts. The views expressed by the speakers and host do not necessarily reflect the official policies of the Department of Health and Human Services, nor does mention of trade names, commercial practices, or organizations imply endorsement by the U.S. government.